Applause was not addressed to me. I didn't say anything yet. But I wanted to take this opportunity to thank very much the organizers and the members of the forum. It's a great honor for me to be here today. I also wanted to say that Pia Breto, who is my current supervisor sitting in New York, regrets not to be here. I know a lot of you know her, and so I'm her messenger this morning. And I wanted to dedicate also this presentation to her because I think she's a very powerful advocate for ECD, and it was important for me to say that. So let me take my notes. For the last few days, I was extremely happy. I reflected a little bit of all the different discussions, presentations. And I was very happy to notice that there is a consensus. And all of us do agree that integrated interventions are what needs to be done for early childhood. And it makes a lot of sense because of the complexity, but also the unicity of each of the children that we want to serve. But I also found that we are very high in those spheres, theoretical spheres, where we try to think of concepts. But in reality, it's often more simple than that, and the difficulty is to apply those theories. And the way humanitarian action is delivered doesn't always permit to do that. So the idea of this presentation this morning is to give you the landscape of the coordination mechanisms that are in place, and that NGOs and international organizations, UN agencies, civil societies, all the main actors are stick into. And I want you to also understand that there is a progression. You will see, we will talk about it, but since the ECD in emergencies, first of all, is something very new, and the way humanitarian action is being done in those sad places is also very new. And so there is a lot of improvement. There's a process that is taken very seriously at a high level. At the head of this is the ERC, which is the Emergency Relief Coordinator, sitting at the UN, and he's the Under Secretary General. And so, can I have some water? Is it possible to get a glass of water, please? And so there's this interagency steering committee that is composed of the main players, and they are working all together on improving these coordination mechanisms. Thank you very much. So let us start. I was requested to put a definition of emergencies. Sorry, you didn't hear me well. There's no one single definition of emergency situations. But I took those two definitions. One is the UNICEF definition, otherwise I would have been grounded when I go back to New York. For three reasons. So one is to show that humanitarian situation and emergencies means the same. Two, the second reason is to tell you there are actually three main criteria that define an emergency, and so I find those definitions incomplete, quite honestly. One is there is a sudden high number of deaths. This is one. And we're talking about hundreds or thousands of deaths. There's no one number, but it's a high and sudden number of deaths. Two is there's an incapacity to respond locally. So there's a need for international community to come and help. And three, what is missing here is that usually there's a statement. A state declares a state of emergency. And if not, the UN Security Council does so. Another definition, we always talk about humanitarian action. Humanitarian action is different. It englobes more than just the emergency. Humanitarian action also comprises of the pre-emergency, we call that the emergency preparedness, as well as the early recovery after the emergency to link to the development. So there are different phases, you see, and in each phase you have different actors as well, and different donors. So it's very important to understand that, because you are dealing with different categories of people that don't have the same expertise and that come on board at different stages. I didn't mention it, but we don't talk about natural disasters as well. If you go to an emergency setting, you will never hear someone talking about natural disaster. A disaster is always human-made. The fact that the volcano will have an eruption, for example, is not a disaster. Mother Nature doesn't do any disaster. The disaster becomes induced by the hazard and the fact that human beings are at the wrong place at the wrong time, or are not protected enough, don't protect them enough. So here, this is the cluster system. Do anyone know about the cluster system? You do? Okay, a few people. So let me give you some background, because it's important to understand the evolution. Between 2000 and 2005, there were different emergencies, and I was privileged to be part of the responses of most of them. And ECD was not there, quite honestly. The only thing I remember when I was in Kosovo, for example, in 1999, and then in Afghanistan in 2001, during the war against terror, if you remember, after 9/11, I remember just seeing some awkward NGOs such as Clown Without Borders, these kind of things, you know, going to camps and trying to make some animations for the children, but not ECD as the way we understand it today. And so, from one to another emergency, you could see an increase of actors coming. And if I mention 2004, the tsunami, that was terrible, 300,000 deaths in 15 minutes. And do you have any idea of how many actors were? I mean, when I'm saying actors, I'm talking about an NGO entity, a group of people wearing the same cap under an NGO name. So do you have any idea of how many actors entity were after 3-4 days in Banda Aceh, for example, in northern Sumatra, to respond to the disaster? We were about 200. And no coordination, nothing, no mechanism. So you could see MSF, Oxfam, Merlin, the Red Cross, the Red Crescent, IOM, a lot of players, even the Scientologists, these kind of people coming on board. And so a diversity of expertise, of mandates, of capacities, but no coordination. So you would see those guys coming to a camp. There was no, it was not camps as per se, but more cabins there, where the IDPs were extremely numerous and gathering in those poor conditions. And so there were lines of those actors coming and asking the same questions based on their field of expertise. What is your problem? How can we help? So you would have, I don't know, MSF asking questions about psychosocial support, about health, health difficulties, etc. And then you would have Oxfam coming on board asking the same questions, different questions, but doing an assessment to the same family, because usually you have, it's the same key person that you reach that represent a family or a village or a group of citizens. And so asking what is your problem in terms of water and sanitation, how can we help? And then you would have another one coming and asking questions about education. And it was very harmful. And it was raising a lot of expectations, and nobody was able even to know whether those people would be served by all of those who came asking those questions. So not working well, no result, nothing, not a good job. And so then after that, in 2005, John Holmes was appointed as a new emergency relief coordinator. And he said, well, let's do something about it. Let's organize it better. And so he put on place what we call the humanitarian reform. And the cluster approach is part of it. And the idea of the cluster approach is to organize the different NGOs and organizations by group of expertise. And so you can see there are 11 clusters. It used to be at the beginning 9, and they were different, and so it's improving, you know, it's changing over time. And it was experimented already a little bit during the tsunami. There were 2 clusters, I remember. One was called the IDP cluster, for example, and I was part of it. But I was more observing than doing anything else. And so it's just meetings where people share their capacities and their expectations and what they could do to help, where they are located, these kind of things. So it was an improvement. For OECD, this is very challenging. The good news is that at least now you can identify where the experts are and where the sectors are. But the bad news is that we're interested by all of them. If you look at, well, can you read? Or, yeah? Is it clear? So you have camp coordination and camp management. This is under the lead of UNHCR. Then you have early recovery, which is under the lead of UNDP. Then you have education cluster, a strong cluster for OECD, which is under the lead of UNICEF and Save the Children. And then you have telecommunication, WFP. Food security, WFP as well. And then you have health, WHO. What is it? Logistics, WFP. I cannot read well. Nutrition, UNICEF. Protection, UNHCR, and UNICEF nowadays, because there's protection, broad protection cluster, and there's a sub-cluster which is called the child protection, where UNICEF is leading. And shelter, which is UNHCR, and then the last one is, what is it? WASH, UNICEF. So you see, those different clusters, they gather the experts together. So it's important to know that. And you also see the different phases, as I was mentioning in the beginning, from preparedness to reconstruction. So integrated ECD in emergency programming. What does that mean? Why is it important? We know it. The ways to do it. What are the challenges? We already mentioned some. And I'm going to present also a little bit on this guide that we developed with UNICEF to help implementing it well. So I would like to come back to the way we think of integrated responses. And I would like to take a very concrete example here. And the concrete example that I choose is the strongest one, I guess, we have today because of the evidence. And it's adding stimulation, what we call stimulation, and I don't like this word very much, to nutrition. And this is a very powerful argument, extremely powerful argument. Does it happen in emergencies? No, it doesn't happen. Why doesn't it happen in emergencies? Because the health agents or the nutritionist specialists, their mandate is to look at the survival aspect of the child. And so they focus only on the clinical aspect. And so when they see a stunted child coming in a therapeutic feeding center, they will just, their objective is to make sure that this child will get a plum peanut or, I don't know, a BP5 or energy or vitamin A or iodine or whatever it is needed so that the child can survive. His or her body can develop. But when we know about the added value of adding stimulation to this, it should be mandatory for them to impose it. And I will tell you why. Because we know that a stimulated child will have improved growth. A stimulated child will have an increased developmental outcomes because he will be exposed to physical contact with his mom, having opportunities to look around, to communicate, to respond to his mom. And also we know that adding stimulation to nutrition will alleviate maternal depression. So this is very powerful. And if we don't do that, on the contrary, maternal depression will impair growth development. And so then you have this vicious cycle where the mother gets more and more depressed and where the child gets more and more deprived. So this is why it's important. Here there are some domains that are missing, but like the religious aspect, the moral and values, the self-adaptive development ones. So what are the benefits of integrated interventions? The first one, it improves the quality of what we're doing for the benefits of the whole child. It minimizes the beneficiary assessment fatigue, as I was mentioning. It increases the use of common standards and tools. It promotes a shared vision of ECD needs and priorities. It promotes interagency and intersector learning opportunities. It increases response coverage. It better guides donors' funding. It informs better decision making and serves as a foundation for planning. It uses resources more effectively by reducing duplication of efforts and overlap. It supports shared monitoring processes and identifies gaps with greater precision. So there are mainly two ways to do it. Either you mainstream ECD within the existing sectors, which is not the best way to do it, because then you have those silos of interventions, and because the clusters don't communicate to each other, you miss opportunities. The very best way to do it is to have convergent services and to put the child in the middle. And I saw that in Haiti, in child-friendly spaces, because all the actors come at the same time and they make sure that all the services are there together. But this is very, very difficult to do. It requires a lot of coordination. So the challenges, the main one is the lack of intersectorality. But also looking at strengthening the systems, not only having a vertical response at frontline responders level, but strengthening the systems for the long-term benefits and the capacity building, and adapt to the different phases. So the guide is all about it. I will go fast because my time is past, but this is the way it's organized. There is basically 3 sections. First one exposing the basic principles of ECD in emergencies. The second one is about the overarching vision of what should look like a good integrated response. And the third one is guidance to all the sectors in case of non-integrated responses, so that at least sectors know what kind of ECD addition they can put to their response. So what is key is to establish a task force to be visible when you arrive in a disaster like that, because we're invisible in those clusters, to make it very formal. And this is one of the ways I did it in Haiti, for example. So you would have an ECD task force with direct linkages with education, health, nutrition, child protection. And in each of those linkages, you would have subgroups with key actors. And those are the possible locations where you could deliver ECD, for example, with the education sector. Those are the ones with the health and nutrition sector. So you see the variety of locations. And those are the ones with child protection. This was what we applied in Haiti. And so you would have a focal point responsible for going to the cluster and transferring what we want to do and taking back from the cluster what is being done also. So there is a communication and an understanding and a coordination between all among the partners. And those are ideas, suggestions of when you can do it. So you can see all the opportunities. They are enormous. I mean, children are everywhere. So it's, opportunities are not missing. I'm passing very quickly because I'm asked to stop. Yeah, so I hope it was useful, and I'm happy to support one of the session, the next working group session, and if you have any other burning question, I'm also happy to answer them. Thank you very much.
Thank you very much for that presentation. I'm Janice Cooper. I represent the Carter Center in Liberia. My question was, how do we in the field know this? I knew this when I talked to you when we did the conference call. Was the first time I realized as somebody on the ground, this should have been my expectation from the actors that were in the response. So how do we know this? How is that disseminated?
Well, the main platform, as I mentioned, is the IS Inter-Agency Steering Standing Committee, sorry. And you can find that online. The main actors are there. Another way to do it is to be part of the clusters. There is the global cluster leads. They have regular meetings in Geneva, in New York, in wherever the cluster lead is based. And it's easy to be part of it. There are enormous networks. For the education one, for example, the famous one is the INE network, which is the International Network for Education in Emergencies. It's thousands of people working on minimum standards of tools and materials and guidance and how to do it together. So there are plenty of entry points. And I'm happy to share with you some of the web links if you want to access to them, but you can even Google them now and you will see. And all the main players are there.
I guess my point is not about this level. It's about if you are an actor on the ground, say you're just an ECD, somebody locally, how do you know what the expectation is? There were cluster meetings in Liberia, right? UN had their own, and then we had ours that they joined. But there was never a discussion about this in the local cluster meetings. I guess that's, where is the channel from between the two in an emergency?
It is contextualized. So in some contexts, you will have a strong already ECD network existing that will be reactivated on the spot. In some other contexts, you will have to do what we did in Haiti because it was invisible. So it's extremely important to be part of it right from the beginning. If you want to have, there is no money for ECD. You have to understand also that the education cluster receives 4% of the humanitarian funds allocated for response, and ECD receives 2% of it. So this is peanuts. And if you want to get the money, if you want to be part of the response, you have to be part of those clusters. So there is no, I'm saying it's new ECD in emergencies. That's why I'm happy to share that with you today, because when you see someone as an expert in ECD in the field, you want to talk to this person and say, what do we do to make it visible? How can we be part of this cluster immediately? And we're not the only ones in this case. There are plenty of cross-cutting issues like gender, communication, youth, you know, it's another age group. So, so you can also decide to have a common task force with those cross-cutting issues.
Professor Alex Coutinho here. So thank you very much for the presentation and, you know, the way it is organized logically and in terms of coordination. However, and clearly you are from UNICEF, it's very much a UN perspective, and it appears as if UN would be the one driving the response to emergencies, and often perhaps that is the case. But there are other emergencies where governments should be driving the response, and there was almost no comment on communities. And I see the definition, of course, as an emergency being a huge emergency that requires external. But for many communities, there are emergencies that don't reach that scale but are just as relevant. Then, of course, there's the issue that Janice brought on, local actors who want to be part of that response. So it's very complex, and I'm not so sure that the UN and its agencies, as important as they are always the main actors to drive the coordination. So I'd just like your comment. There may be some countries where that's true, but there may be other countries where that's not true. And so how do you get the other very important actors, government, communities, and other non-governmental organizations to be part of and drive the response?
Thank you very much. This is a good question. I had to run. I didn't manage my time very well, but in this presentation, if I had more time, I would have explained that when we established the task force, or even within the clusters, you have a representation of the government, you have a representation of the communities, you have a representation of all the different levels of a society. The clusters are not a systematic thing, that are not taking place all the time. when the governance is strong enough, when the institutional state didn't collapse, then they take the lead. We don't replace the government capacity. We're just there when there's no capacity, which was the case in Haiti. Everything collapsed. Everything was destroyed. There was even no archives, nothing remaining. So this is very clear. We're not there to have a top-down approach. We're there to take what exists locally first and look at what exists locally first. And I was mentioning the dimension of the horizontal dimension that we want to strengthen systems. This is being done with the governments. And the other responses that are taking place to the vertical responses for the immediate needs of the survival and development needs of the children, this is taking place at community level. So this is where you would see some informal ECD settings, you see, and the main leaders there are the communities themselves. So they are part of those clusters. And yet there is no obligation for NGOs to be part of this cluster system. And there's a lot of critiques about this cluster system that is understandable. More and more do now belong to this system because they realize that those are the main channels of delivery of the resources, first of all. This is where the expertise is. And the partners, they need grants, they need money, they don't have money. The NGOs, they are funded by the UN, many of them. So they are part of it. And when to fundraise at the beginning, there's a very specific system for fundraising. In the first 3 days of an emergency, you have the flash appeal, which is an inter-agency request, call for money that is being done per expertise, per location where the people are located, etc. So more and more and more now we go towards this coordination system.
Professor, you had...
Yeah, thank you for the presentation. It was really, really interesting and opened my eyes in a number of areas. When I listened to this conversation, both the questions and your comments, it kind of makes me think that you're responding to crises. You're raising important issues, but you're still responding with a very bureaucratic system. And it's the bureaucracy itself of coordination which is your main challenge. So I would advise you to take a look at what cities are doing around the world to respond to their citizens in new ways, and think about deploying new types of communication tools. The biggest challenge that you face is that you have a small known universe of social connections that respond in a crisis. And that social network doesn't have all the solutions, as you've identified, that are needed on the ground. And there's no way, in a minute of a crisis, that everybody can communicate effectively. So your communication tools that you're using today limit themselves naturally. What some cities are doing to overcome this challenge is they're putting out things, they're using technology to put out what are called call for problems. It comes from the basic idea that for decades, cities and governments have issued what are called requests for proposals, or RFPs, for solutions, in which the city has always said, we know the problem, we just need you to provide the solution, which is really what your committee does. But there's no way that a committee or a city can understand all the problems of a community the way its citizens can. And the same is true for your community. Like, I'm sure that UNICEF never thinks, for example, that IBM might wish to participate. We did in Haiti. We participated in Liberia. We participated in the tsunami in the Philippines. We participated in Nepal. But I'm sure that UNICEF and the UN don't think that technology firms like IBM or Microsoft or Google play an important role in coordinating response in emergencies, as well as other firms. So the question is how you bring in all of this external talent that is not part of the traditional emergency response, even in areas like ECD, who could provide solutions that you're not even aware of. And that's where I think you have to go beyond the committee-based, bureaucratic, top-down solution and start looking for more technology solutions that allow other players, universities, non-traditional participants, who could respond and offer solutions for many of the problems that you may not even be aware of. So I'd urge you to rethink the committee structure, rethink the communication program. Think about how you can involve more people in the process.
This is extremely important what you're saying, and we do think of those things. Innovation, technology, these kind of things. We do think of it very much. I agree fully with what you just said, and I'm embarrassed sometimes to be part of this big apparel, and with it, which is too top-down most of the time, and it matches your presentation of yesterday. And but this is what you have. If you want to have the money, if you want to have the capacity, if you want to, because you use your partners, first of all, to respond. But I will tell you of one innovative thing that we are working on now, that I've been seeing as an improvement. We used to do registration of IDPs with papers like that, and people were printing, putting their stamp on the paper, to get their ration at the end of the day. And so there were a lot of, it wasn't working, a lot of papers were lost, very complicated, a lot of were abusing, etc. So now we are with this code bar card with real-time identification of people with their real needs. We know how much ration they receive, this kind of thing. So this is a new technology platform support that we're using. And there are many like that, like people, all of those people, they have a mobile phone. So we're thinking more and more, how can we reach those isolated pockets of children that are very vulnerable, but they have a mobile phone, they are all on the same network, and we could just text, in terms of family reunification, for example, when you have a family divided and searching one of another or another member of the family. This could be an amazing tool as well, but we need more for that. We need to have a lot of actors on the table, and people like you, for example, if you could be part of the global coordination mechanisms, that would be a plus, definitely.
Professor.
Thank you for your presentation. I have just a simple question. You talked about the importance of stimulation of children. Now, I find it difficult to appreciate how stimulation has any role during an emergency situation. I agree that during normal growth and development, children need to be stimulated. So what is the evidence that stimulation does in fact have anything positive?
Well, I mentioned the added value of stimulation. I don't like this word. So to me, we're talking about loving your child here. This is very basic. This is very natural. But in some countries, unfortunately, this is not that obvious because of cultural impairments, because of the shock of an emergency, because of the fact that a mother would become very emotionally disturbed. So, but I mean, it's like stimulation is about having love, and love is about reciprocity. You cannot have love if it's only one way. So you need to have the mother and the child responding to each other. This is what I'm talking about. And when there is not any communication during breastfeeding, for example, it doesn't work. And if it's on a long stand, the impact is even more and more negative. And there are studies about it. The WHO and UNICEF, they developed a package which is called the Care for Child Development. And they've been doing even a longitudinal study in Jamaica. I think it started in 1999. And it shows exactly that. I mean, what is the benefits, not only when the child is 3 years old, but in terms of the developmental outcomes and how the young adult who was this child stimulated does better in a society versus one who wouldn't be stimulated, having been stimulated. So there is evidence about it, strong evidence about it. And it's logical if you look at a mother with her child, and if there's no, it's like thinking of putting a child in front of a TV instead of having a caregiver interacting with the child. Why is it negative to have a child in front of a TV of 3 years old? Because the TV will not respond to the child. It will be a one-way only. You see? So stimulation is so obviously important. But it doesn't take place. And why doesn't it take place in emergencies? Because first of all, there are very, very, very few mothers in emergencies. Because emergency situations are non-family duty stations most of the time. And you wouldn't see a mother going to Iraq for 1 year and leaving her children, would you? So those that are counseling the mothers, they, most of the time, they don't have the practical skills, they have the theoretical skills, they know a lot about it. It's like if you ask someone to teach someone else tennis, and this person would have never played tennis, but would have just read books about how to hold a racket, it's exactly the same. So you need, first of all, to have some mothers that know, and the impact will be stronger, you know, that know how to breastfeed and what it is and what you feel, and when it doesn't work, how to look at your child, how to massage his or her feet, how to communicate, to look at these kind of things. This is very natural, and it makes a big difference.
So let us take the last two questions. Kimber, you have one? Jana?
Can I just make a follow-up comment first? Because I was listening to you talking, and I thought, well, one way that we might consider reframing this stimulation idea is to use the word that you used in describing it, which is communication. Because really what you're talking about is communication and reciprocity, as you described so well. And I wonder if we might borrow on some of the other themes of work that are part of this forum, which I know come from autism. And if you think about, not to draw too strong of a parallel, but if you think about the way you teach an autistic child, you make things very explicit that many people have internalized and do out of instinct. But if you teach communication as a very explicit set of directions or actions in an emergency situation, where you say communication means talk to your child, communication means hold your child, listen to what your child has to say, and make it a very, like I said, explicit set of actions. I think it makes it much easier for people who are also busy, who may not be breastfeeding, who may not have a child at home that they interact with and have that as an internal experience, but making that something that is taught in a very kind of pedantic way almost. It breaks it down into smaller pieces.
Yeah. This is why I don't like the word stimulation. I find it very mechanical, and I use the word love, which embraces, I think, more than only communication. There is the notion of play as well. I mean, I developed the ECD kit for UNICEF, which is a box of toys, early learning toys, these kind of things. And we use them in those baby tents. We call them the baby tents in Haiti, where you have a line of mothers coming to breastfeed and to be counseled on how to breastfeed well, because obviously it doesn't work. And so we set up those toys, and the babies can start, or very young children can start playing with those toys and have social interaction with others, etc. So it's not about communication only, it's also about having access to fine motor skills development, to all the senses, etc. But to me, it's about love primarily, because it's about when you love someone, you want to make sure that this person has the best, you know, gets the best. This is what it is about. So it's not just communicating for the sake of communicating, but it's communicating and trying to understand what are the needs of your child. And they are very specific, and sometimes there are reasons why your child wouldn't breastfeed. It can be because, I don't know, he has a stomach ache. It can be because there is no communication. It can be because he's not hungry. I don't know. There are plenty of different reasons. And the way the mom would understand the things just by loving her child naturally would facilitate communication, play, interaction, stimulation, skin contact, these kind of things. But it's a package.
Last question. Sorry, Jana, do you want to come?
I just think it's very difficult to teach love.
Sure, it is. But to me, I love to see this world in our guidelines, and I liked that Gillian from UNICEF, the first day she presented, she mentioned it. And also John Lombardi, when she launched the ECD Matters, Bernard Van Leer newest report, she mentioned love, and I think this is critical. And in those situations where there is an enormous distress, because it's shocking. I mean, people are. You could see how emotional it was yesterday to look at those videos, but when you are there and you see a disaster of such a magnitude, this is amazingly disturbing. Even us, we are disturbed when we are there. And talking about it even makes me embarrassed. You know, I have memories of it. So love is disturbed because a mother would feel guilty, responsible for it. How can I help you? You know. And so we need to re-encourage this, to re-empower the mother in a natural way. You recomfort both the child and the mother. So I think it's very much about love.
The last question, Kimber.
Great. Arnaud, thank you very much for your presentation. So I'll just say one follow-up to this conversation about love and mothers is I think that we're leaving out fathers. And there's probably many mothers who actually die during some of these disasters, so I just wouldn't want to leave them out because they too can provide love and quote-unquote stimulation, communication, whatever we're calling it. But my question really shifts away from that conversation to a conversation around science and research and learning from actions on the ground, and not to take away from the resources that are going to provide the emergency response, but is there an attempt to embed some technical folks who can come in and actually measure what's happening before, during, and then after in order to learn from it and provide better emergency response in the next emergency?
There's such a big need. Thank you so much for this. And I mean, I'm encouraging you to approach UNICEF and other big players because we are so much into it now. And it also joins the previous comment about new communication technologies and empowering local communities, etc. So yes, we need some action research, very much so. We need to start from there and being innovative and see then if it works and build from there. And UNICEF is very open for that. Especially Pia. Pia, if you mention the word innovation, she will be like, come, let's discuss about it, you know. And I have also myself a lot of ideas on how we can make it. I'm not going to share them now because it's a very preliminary stage and I want to talk about it to Pia first. But there are plenty of very good ideas that could be implemented right away and tested and engaging. You know, one other thing that is missing in this world of top-down approaches is that we are not accountable towards the ones who are serving. They are not aware of how much money is spent for us versus how much we spend on them, you know, and they should be part of it. If there was a disaster in my country, France, tomorrow morning, and I saw those guys coming from abroad and telling me it's going to be like that, I'd say, hold on, this is my country, I know how to do it, please let me know. I mean, you know, I want to be part of it, and I know how much it's going to cost, and I would have coping mechanisms that you wouldn't know about it. So definitely there's a need to improve that. And I wish we could invite to those global clusters, and I mentioned that many times, those IDPs, you know, that are there. They are the ones who should decide and plan and design the responses with us, more than us deciding in our spheres and then applying something that would not be necessarily adapted. So there's enormous room for innovation, very much so, and action research. Thank you for that.
There was one question at the back. Do you want to just briefly?
Just from a practical perspective, I'm wondering how long did it take you after the earthquake to set up these child safe zones and baby tents?
3 weeks, more or less, yeah. I mean, I was there as visible. I was sent there as the emergency coordinator for ECD. And before going there, I was in New York. I contacted some of the existing networks, and UNICEF was already based there, so we were already doing some ECD response. So first thing I did is that I established this task force, and I brought on board Plan International, Save the Children, all the main players that were there, Care, Intentional, etc., etc. And then we decided on who would do what where. I did a stakeholder analysis immediately. In the next 3 days, I knew what was the capacity of those partners. And then I immediately linked with the clusters so that not to lose the opportunity of the funding coming up. And I wanted to be part of the flash appeal. So these are the steps that you do immediately. And if you miss it, then you're out, and you have to write a proposal and to send it to ECHO and to whoever, and to receive the funds 6 months later, and you missed it. You missed your chance. And so the baby tents and these kind of things, this was part of mainstreaming ECD within the existing sectors. So because UNICEF, we have all those sectors, it was easy for me, and UNICEF is leading the nutrition sector. So it was very easy for me to plug ECD onto this sector and make sure that in the baby tents we would send those ECD kits, you know, which I developed myself. So I was even more proactive in promoting them. So this is how it happened. And 3 weeks after, you could see those ECD kits that were already pre-positioned in country, being used, and training taking place for the partners and the caregivers with very low literacy capacity being empowered to use it, etc., etc.
Well, thank you very much, Arnold, for a very interesting presentation and a very lively discussion. So let us give him a hand. The next session we will see a video, and it should explain the objectives of the breakout sessions. It will get started from there.
On health and developmental outcomes with a particular focus on what can be done for early child development in these particular contexts. My role is firstly to apologize for not being here in person, since my work and duty travel precluded my staying till the end of this planned workshop. But I'm very pleased that my colleague Dr. Ann Maston is with you. I would like to underscore why this workshop is so particularly important. So as many of you are aware, there has been a recognition that in the global burden of maternal and child morbidities, and particularly in relation to the distribution of child mortality, we are now looking at a situation where close to around a third of the entire global burden of premature child deaths are in geographies where there are either conflict situations or major humanitarian emergencies and population displacements. So these things are now no longer outliers. They are a reality of the day-to-day operations in health systems for both health workers, humanitarian emergency responders, and civic society working in tandem to try and make the best of what they can in given circumstances. If you look at the typology of what we are dealing with in the context of acute disruptions, these can be broadly defined and divided into three large categories. One is humanitarian emergencies due to natural disasters, and you've seen plenty of examples of that in recent years, ranging from tsunamis to earthquakes to floodings. And the second is conflict. And population displacement by acute conflict and consequences of conflict are hugely important, just given the scenario that in the region that you are meeting, there have been conflicts and smoldering issues that have been going on for the last several decades. And the third, and a more recently obvious one, is the impact that outbreaks or disease conditions can have through both mini epidemics and the impact that can have on health systems. Ebola is a remarkable example of what the world had to really garner all of its resources to help control last year. And with all the efforts and money that we threw in, it still ended up by killing several thousand individuals, and a circumstance where a lot of the world's resources were geared towards preventing that outbreak from spreading out of West Africa and for doing something within that population at large. The lessons from Ebola that will form a large part of our discussions during this workshop are extremely important. Firstly, because they tell you what a broken health system can do in terms of increasing risks within a population, and secondly, how a lack of health system preparedness for these consequences can impact on the perpetuation of some of the problems that emerge outside of outbreaks. These outbreaks and these emergencies are extremely important because the populations at greater risk are those of women and children. So these outbreaks are particularly important because a major constituency that's affected by either population disruptions or the way society reacts to this are women and children, which are at greatest risk not only from exposure but also from the effects of the breakdown of health services and health systems, which particularly impact on this group of the population. So as you can imagine, within the recent Ebola outbreak, a greatest risk period was that during pregnancy and childbirth for fairly obvious reasons. And these kind of similar exacerbations of risks have been noted in other emergencies also, particularly those that affect children and women during famines, population disruptions and crises, and in situations of population movements. Now, we have a very interesting opportunity in this particular workshop to consider a range of things, and I would like to underscore just three as you start your deliberations. Firstly, what has been the recent learning from such experiences in the context of existing guidelines and existing strategies for maternal child health, and what is the awareness within those existing strategies of the importance of protection of women and children and interventions that can promote and protect child development interventions. Secondly is also who are the state actors and actors within the humanitarian response teams who need to play specific roles at different time periods, starting from an acute response to stabilization and to restitution of services in the aftermath of such disruptions and disasters. And the third, is there any guidance around the time frame of actions and interventions so that as soon as you are beyond the acute immediate response, that you could put services and systems in place to not only focus on child survival, but also to focus on what could you do potentially to maximize opportunities and gains for children and families who could be living in some of those circumstances for many, many months to come. So a fairly ambitious, but an extremely important agenda ahead of you, and I wish you well in your deliberations and welcome you to this workshop. Thank you.
The objectives are very clear, what we want to do. So we have three groups. The first group is the human-induced disasters, and the chair for that group is Christine Muteganzwa. Did I say it correctly, Christine? Christine is from, correct? You will correct it if I. So Christine is from Rwanda, and she is the Kayonza District Clinical Director, and she has been involved in working with partners in health. She oversees the implementation of partners in health in Rwanda, clinical programs, and serves as the liaison for clinical program leads and the medical director of the Rwandan District Hospital. So she will chair that group, and the moderator is Amina. So Amina, oh, Amina is here. You know Amina by now. So. And then a perspective will be provided by Bonita Brungi. Okay, sorry. The second group is the one on human-induced disasters. No, sorry. The second group is natural disasters. And the chair for the second group is John Kong. Sorry, John is here. And John is the executive director of Restavik Freedom Foundation. Is that correct? All right. So, and the moderator is Tina Haider. Tina? Tina is the deputy director of the early childhood program of the Open Society Foundation, based in London, and leads OCF's early childhood development projects and grants in Africa and Asia. And a perspective for that will be provided by Vishnu Bhatta. Vishnu, yes, thank you. So Vishnu is currently working as director of PSD Nepal. The third group, and they will meet at the bachelor, where is it? This one? So can you, I'm hoping that this will be exclusively, so can you show your hand, which do you want to join this? We need probably to recruit more for this group. Okay, one more, two, three. Okay, let us see the third group. And okay, the third group is outbreaks, and the chair for that is Valerie Bimon. Valerie, okay. Valerie is the senior program officer responsible for the emergency response portfolio within the Global Development Department at the Bill and Melinda Gates Foundation. The moderator is myself, and a perspective will be provided by, hopefully someone will. Okay. Yes. So that group will meet in the Awash room. We met there yesterday, so okay, you can follow us. Who will be joining that group, the outbreaks? No one is interested in outbreaks. We need to recruit more. The first group was very popular. I don't know why, but okay, so we have a good crowd here. So these are the three groups, and we will convene. The discussion should be for about 2 hours. We will reconvene here at 11:30. So what we want from you is that you will discuss, and please select someone to record your responses so that someone can report back what you discuss. And we want you to identify 3 areas that you feel really important and can be presented as policy guidelines. But we are interested in the whole discussion, but just present your discussions by identifying 3 most important ideas. So we will get started and we will be back by 11:30. And if you can write down your responses on any electronic media so that you can share it with us, that would be very helpful. Sure.